So this is one of the things that I always try to highlight with my students, especially. Oftentimes we hear like, this is the best supplement, this is the best magnesium, this is the best iron on the market. And I always have to remind them that the best for whom?
Welcome to Personalized by VitaminLab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Deiser. Please remember that the following discussion is for educational purposes only, and it's not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome to Personalized. Today we're talking with Dr. Corina Dinca, a naturopathic doctor with a deep commitment to holistic health. She completed her Doctor of Naturopathic Medicine program at the Canadian College of Naturopathic Medicine, following an honors Bachelor of Science degree specializing in health and disease from the University of Toronto. Corina's passion for holistic health has led to a diverse career. Her clinical practice focused on individualized care and prioritized the management of autoimmune diseases and endocrine disorders. She currently instructs courses at the Canadian School of Natural Nutrition and is a therapeutic advisor for one of Canada's largest supplement companies. Corina's objective is to empower individuals with the knowledge and resources needed to manage their health effectively, promoting longevity while reducing the risk and advancement of chronic diseases. Enjoy our episode with Corina. Hi, Corina. Welcome.
Thank you for having me.
Thanks for joining Personalized.
Yeah, no, thank you again for having me and taking the time to talk.
Amazing. We really appreciate you joining our podcast. We're so thrilled to be teaching both practitioners and the public about individualized and personalized medicine. We thought you'd be an excellent guest to have on our first sort of round of guests. So really thrilled to have you and looking forward to our conversation today.
Likewise.
Let's jump right into it. I'm really interested in your process, your foundations, how you got to this place in your career. Can you tell us about what inspired you to not only become a naturopathic physician, but take this step into individualized and personalized care?
Yeah, for sure. Becoming a naturopathic doctor was fairly easy for me in terms of deciding, because I was lucky enough to come across the profession really early in my student life in university. So in my first year, we had like a career fair, and one of the naturopathic doctors, actually Dr. Alexander Hall, was there, and I had the chance to talk to him, and I fell in love with the idea of naturopathic medicine. I knew I wanted to follow some type of medicine route. I used to volunteer a lot in hospitals prior to going to university. I just did not really enjoy that sterile type of look, type of environment. And so I didn't quite know how to really apply, my, love for biology and medicine. Also, I used to do art back in my high school days, and also apply that as well, kind of like combine it in a way. So from that moment, from my first year, again, I was extremely lucky knowing that, okay, this is what I want to do. So then I catered my entire bachelor's towards naturopathic medicine.
Wow, I love it. And that was at the University of Toronto?
That was at the University of Toronto, yeah. So those career fairs, they do prove to be successful, I think.
Absolutely. Did you know about naturopathic medicine before that? I'm so interested.
I didn't. I knew about homeopathy. I had a very long history with it, being treated as a child. So I was born in Europe, in Romania, and obviously we also had allopathic doctors for a lot of different concerns. We used homeopathy, just like my family and I. So I had that experience very early on, and I was successfully actually treated with homeopathy many times. So having found out about naturopathic medicine, I was like extremely excited to kind of combine, as I said, the medical part of it, the science part of it, the research, as well as homeopathy and plant medicine as well too. Yeah.
Absolutely. I'm sort of in the same boat as you. I'm from Nova Scotia, and we didn't really have naturopathic physicians growing up, but we did have pockets of integrative care, right? Like I saw a massage therapist and I saw a chiropractor and I worked in a chiropractic office. And it wasn't until I came out west to British Columbia in the Navy that I was exposed to naturopathic medicine. I thought, oh my gosh, we can combine all of these things into one profession, and in our province, they're practicing primary care. It was so cool. Just loved it.
I absolutely agree. Yeah.
What were you studying? What were you taking at the University of Toronto? I love that campus, by the way. I love it there. I just visited for the CCNM graduation. I was at the graduation, so I was just on campus. We had it at U of T.
It is a beautiful campus for sure. Not fun to cross the campus in the middle of winter, but
I bet. Oh my gosh, I never thought of that.
But it is a beautiful campus. So I did a human health and disease specialist. So because I knew what I wanted to study, I basically took a little bit of everything, like immunology, cell biology, and nutrition, biochemistry, and so on. So
cool.
A little bit of a taste of pretty much everything.
Wow. Yeah, really, you did. If you're talking right now to, say, a first-year undergraduate student who's just learning about naturopathic medicine because we came up on their YouTube or something, what would you say to them about our profession? How would you describe it? How would you encourage them to look into it a little deeper?
Good question. I definitely would say not necessarily to follow the same path as I did, but to kind of try to acquire broad spectrum, I guess, of different types of classes, of different, I guess, subject areas, and to understand, because from the naturopathic perspective, right, we look at the whole system, right? We don't really study things, although we look at things in isolation, we then kind of put all these different parts together. So I think it's very important to acquire knowledge in all of these areas in order to later on integrate it into the whole. Because if we generally look at allopathic medicine, if we were to compare it to naturopathic medicine, generally we dissect things a little bit more in allopathic medicine, and we don't really connect the systems as much, right?
I love that. A systems-based look or consideration in your study. It's so important. I tried to do the same thing when I was studying. I didn't know about naturopathic medicine, but I had this like real interest in psychology, but I was studying chemistry. Luckily, my school let me take psychology as well, which is really cool. They kind of created this thing where you could do both at the same time.
Oh, nice.
Little did I know I'd be talking to people all day long for the rest of my life. I didn't know that I would need to know so much about how to communicate effectively, and that was very valuable to me. But it sounds like you created this holistic approach or holistic viewpoint so early on, like before even attending school. And you went to CCNM, right?
Correct. Yes, in Toronto as well too. Yeah. So I was like, I took psychology as well too. So again, it was very nice to combine the different, I guess, science practices later on into kind of one. Yeah.
Definitely. When you started out, when you got into your career as a naturopathic physician, did you have a niche, or were you still thinking very broad, very holistically, and you know, or were you niche based?
No, so I went into family practice, but I always say that your patients kind of choose you. So I ended up seeing a lot of autoimmune conditions. I didn't market myself towards that niche. It kind of ended up in that direction. But I did start as a family practitioner. So initially I was seeing all kinds of different patients, different types of conditions. And then, as I said, later on, I noticed that I had a higher predominance in clients with autoimmune conditions.
Tell me a little bit more about that. What was it about your approach to autoimmune conditions that brought people to you? How were you integrating the different systems?
Well, I think, again, like when we look at the immune system, right, we're not looking at it, again, from a naturopathic perspective, just at the immune system, right? We have to take into consideration the gut, especially. The digestive system, all the hormonal, the endocrine system as well too. So all of these systems, again, affect other systems, including the immune system. And, you know, you mentioned having studied psychology, and then we know, for example, stress and psychology, or I guess somebody's perspective in life as well too, also affects these systems. So initially, as I said, like I didn't quite have a focus on the immune system, but it kind of increased in frequency in that. And I was quite surprised too, because when we were studying actually in school autoimmune conditions, we learned about the incidence, right? And initially, it seemed like these conditions were fairly low in predominance. And then as I progressed through my career, again, whether I was seeing a bigger, percentage of individuals as a result of having that focus later on, but I do think autoimmune conditions have increased in frequency or their incidence has increased, from the time that I started in practice. And then as I progressed through my career as a clinician. So part of it may also be the fact that we recognize them more nowadays than maybe in the past.
Yeah, maybe. But what a great joy for us to be a team member thinking holistically about this. Like, I've gotten so much value just saying, let's improve your sleep, right? Like, let's work on keeping stress low. I often will say to people about this study where they're assessing the responses to vaccines. So it was a study on medical students, and what they were doing was they were giving vaccines and then seeing how the antibodies were produced during exams and not during exams. Mm-hmm. And the antibody responses during exam periods were less. They were less robust.
Interesting.
Yeah, and so it's like, wow, this is like a really stressful time. They did the same thing with sleep with insomnia.
Right.
The threshold was like 5 hours or something. I think it was right around 5 hours, where if you get less than 5 hours in a row, responses are worse for the production of antibodies against vaccines. Really fascinating stuff, but it speaks to exactly what you were doing, right? Like, let's work on sleeping better. Let's keep stress low. Let's improve the gut. I just love that approach.
And then this is also what I oftentimes tell my students, sometimes, especially when you are a new clinician, it can be so daunting, like, oh my gosh, I've never treated this condition, or I've never seen this type of patient before. You still have to go back to the basics, right? As you mentioned, sleep, right? What is this person's sleep, and address their sleep hygiene, right? Have a handout for them,
Right.
Have a dark room. What is this person's stress level and how do they manage their stress? Because at the end of the day, all of these pieces do fall into or do affect whether it is an autoimmune condition, a hormonal condition, a digestive issue. You still have to address the basic functions, I guess, of the body.
Definitely. That's a really good point. I mean, I'm 10 years in, and the other day I was working with someone who has an autoimmune condition. They were on a medication I never heard of. Mm-hmm. And I'm literally seeing people with autoimmune conditions every single day for 10 years. And a new medication arrives in my office. Right. Oh my goodness. So that fear of the unknown, that fear of being a newbie, that fear of it being too complex can be so incredibly daunting, and it might last for a while. Like, it can happen over and over. And I always try to step back and think in the way that you do, that this holistic approach is ridiculously valuable. There's so much we could be doing to help a person feel better.
Absolutely. And nobody's perfect in all those areas, right? We can all improve on our sleep. We can all improve in terms of reducing our stress or improving our diets. I don't believe everybody is again, perfect in every single one of these areas. Yeah.
Right. And what does even perfect mean?
Exactly.
Oh,
yeah. Perfect for them.
Hey, least, good transition. Personalized.
Exactly.
Absolutely.
Personalized. Yeah.
What do you think about when we think about personalizing nutrition and nutrient absorption? What do you think about when you're working with a patient or teaching these concepts with respect to nutrition programming, nutrient programming? How do you personalize your approach to patients within patient support?
And a very, very good question. So this is one of the things that I always try to highlight with my students, especially that, oftentimes we hear this is the best supplement. This is the best magnesium. This is the best iron on the market. And I always have to remind them that the best for whom, right? You always have to look at who do you have in front of you as your client or as your patient, right? What are their concerns? What are their conditions that they're dealing with? What are their genetics, if you're looking at their genetics? And then the best supplement for them is going to be based on that, not on what's currently presented in the media or currently the hottest topic in the supplement world or diet, right? So oftentimes we hear intermittent fasting is the best diet, and again, when you're new, right? You're like, okay, I'm going to apply this to all of my clients. Like, and I hear intermittent fasting, heals everything, right? But then again, you have to question, like, okay, who is my client again, or who is my patient? Because if they're pregnant, then intermittent fasting is probably not the best diet for them, right? Same thing applies to supplement, right? It can be the best, but for whom, right?
Absolutely.
And this is where individualization comes in, right?
Can we dive a little deeper in both of those examples? You brought up both magnesium and intermittent fasting. And I think it'd be so valuable for our audience to learn a little bit more about how to individualize both of those, one being a nutrient prescription and the other being a lifestyle change.
Right.
You can choose one and take me down a path of how you might choose, for example, the type, the timing, if it's intermittent fasting, and for whom.
Right, for sure. So, first of all, let's look at the research. Most of the research with intermittent fasting or with this diet was done in males, right? So we automatically cannot necessarily apply it to everybody, right? We do see really good outcomes on this diet in terms of metabolic health, particularly cardiovascular health, right? Weight loss as well too. So if you do have a client that maybe is male, looking to lose weight, has this glycemic, has dyslipidemia, and so on, intermittent fasting may be appropriate for them. Now, can we apply this, for a female patient? Possibly, but this is where that initial intake is so important, right? What are the health concern of this client, right? And then what is her current condition? What are her goals, right? Maybe she's overweight and she has dysglycemia and weight is an issue. Let's say she's trying to get pregnant. Then intermittent fasting may be appropriate in order to lose weight, to become metabolically a little bit more healthy, hormonally a little bit more healthy, and then try achieving pregnancy. If, she is actively trying to conceive, then intermittent fasting may not be an appropriate diet for that particular client, because we now know from studies that it may actually affect hormonal health. It may suppress ovulation. Okay, so this is why we cannot, I think, generalize that a diet is the best diet. We always have to ask the question, like, for whom, right? Because what's best for me may not be best for you.
Absolutely. What types of intermittent fasting are you interested in? I know we've been doing a lot of 16/8 and 24 here. What's your kind of go-to, and where might be a good case where you think it'd be valuable? You gave the male case. What would the timing be for that?
I mean, it really depends also on their adrenal status, right?
Good point.
Like, are they adrenally fatigued? Do we need to build the adrenal glands before, maybe, as you mentioned, we go with a more extreme time, a fasting window, right? So again, this is where you would have to individualize again. And also, you also have to meet the client where they are. I think that was one of the big mistakes, not big mistakes, but mistakes you make when you're very new in practice. You present your client with this, at least I did, elaborate plans. Like, okay, we're going to revamp your lifestyle, revamp your supplementation, your diet, your stress management.
You're no longer allowed to eat until lunch.
Exactly. And it becomes so overwhelming, right? And I've had clients who, would come back, or patients would come back, and I would ask them, like, oh, were you able to implement these things? And the answer was no, because they were not ready to implement, X amount of supplements and make such huge changes within such a short period of time.
Right.
Yeah.
I love your answer. I mean, that's what this show is all about. This is not the show that you come to where you get just the advice that says, 16/8 is the most appropriate for everybody. It's going to save your life. Not at all. You've given some really good examples. This whole show is really about the it depends. And those examples are what we're trying to pull out here. In my practice, we have the opportunity of measuring muscle mass.
Okay, amazing.
Well, we measure muscle. And for some people who have low muscle mass, it really reduces their ability to intake protein and have protein at the right time if they really need that. So we see muscle go down and then we sort of panic. So my whole thing for the last few years has to try to prevent that.
Muscle loss, yeah.
Yeah, it's another example of just the things that we want to try to pull out from the show. But you gave some really, really good ones in infertility, for example. And I'm interested to know about on the magnesium side of things,
For
could you
sure.
tell me a little bit about how, because this is really where your expertise shines. Everything I know about you, you are considered an expert on nutrient types, nutrient forms, dosing strategies. And so, part of the key reason we wanted to have you on was to talk about this. And so, because it's so prevalent in my practice, magnesium deficiency, like we do a lot of red blood cell magnesium assessments and we see it low so frequently. We have to use it a lot. And I'm not the best at using it. I, for some reason, need to learn a bit more about the specifics. Could you share the different types and how you might consider which one is more appropriate for the person in front of you?
For sure, yeah. So, well, let's talk a little bit about mineral supplementation in general, right? And this is where I would say supplementation is very different than dietary, right? So when we acquire minerals from our diet, they generally are well absorbed unless they are found in food complexes, and we'll talk more about that with a lot of phytates and oxalates and so on. But generally speaking, if your digestive system works well, you will be able to extract minerals from food, right? Unfortunately, most of us are mineral deficient, I should say, and other nutrients as well too. But mineral deficiency, I think, is quite prevalent. And as you mentioned as well too, you do a lot of RBC magnesium. I'm sure iron deficiencies is fairly common in a lot of people's practices as well, and so on. So many reasons why we are, I would say, mineral deficient. Diet, stress, medications, right? Our food is not as, as high in minerals as it used to be, because our soils are depleted and so on. So then when it comes to mineral supplementation, it's again, you have to ask that question, like, who am I supplementing and for what, right? In this case, it's also like, which compartment am I trying to get this mineral in, meaning which compartment of the body, right? Am I trying to keep it in the maybe intestine? Am I trying to get it into the blood? Am I trying to get it into the like general tissue, muscle maybe, or the brain, right? And based on that, we can kind of choose the right form of a mineral, in this case, magnesium. So magnesium itself, or when we supplement generally with minerals, they come bound to another molecule, right? If they are by themselves, they're very unstable. And so this is when minerals are generally in their ionic form. Magnesium, for example, has a 2+. If you remember back from chemistry, it has 2 electrons, right? And generally speaking, magnesium will be bound to another molecule. Well, that molecule will determine where that magnesium ends up in, and also what type of side effects or benefits that supplement would have. So there's many different magnesium formulations. I'm sure you're familiar with magnesium bisglycinate.
That's the one I mostly use.
Yes, yeah.
To be
good,
perfectly,
yeah.
For the muscles, I typically use bisglycinate, and we give it before bed. Mm-hmm. But then I know that there's malate and oxide and citrate.
Yes, and taurate and threonate and orotate. So there's quite a few ones. So let's look at minerals in general. When they are bound, what we call ionically, so they don't have very strong bonds to their carrier molecule, they oftentimes become dissociated in the stomach acid. Magnesium oxide, you talked about. There's also magnesium carbonate, which is oftentimes present in antacids, for example. So these molecules generally are not very good at keeping magnesium bound to them, right? So when they enter the stomach acid, they generally dissociate, right? So this is where we kind of get into like side effects and also competition between minerals. And so, for example, when magnesium is dissociated, it can be absorbed through ionic channels, but chances are it's going to be bound by whatever else is in the digestive system. And the reason for that is because it carries a charge, right? So you have now this magnesium 2+. So anything that is negatively charged will bind the magnesium and generally will not allow for it to be absorbed. So if you have any fiber in your stomach, or if you have any fat, obviously in your meal, that will bind to magnesium and it will not allow it to be absorbed. So ideally, what we want is for this magnesium to be bound to what we call a ligand to a molecule that makes it stable and it's not easily dissociated, right? Especially in the stomach acid. So this is where, for example, glycine comes in, because magnesium is bound by two glycine molecules. So it no longer carries that charge. It no longer is attracted to negative molecules like fiber or fat. So then it can be absorbed through a different mechanism than as an ion. And so in this case, when it's bound to those glycine molecules, the body actually has transporters. So the body will actually use energy to absorb the magnesium through these transporters. And then it unpacks the magnesium later in the liver and then delivers it to the tissues that it needs it. If magnesium is, again, bound to these, I guess, I don't want to say poor molecules, but ionically bound to these other molecules, it will dissociate and then interact with the contents in the stomach, most likely not being able to be absorbed. Yeah. And this is where you can also get into side effects, right? So this is why, for example, magnesium oxide is a poor form of magnesium if you're trying to increase magnesium status in the body, in the muscle, right? Because it's not well absorbed, it attracts a lot of water, and it causes loose stools. Now, if you have constipation, magnesium oxide is one of the best, I guess, laxatives in terms of helping to move the bowels. Obviously not for long term because you want to find out why the person's constipated, but if you're trying to move the bowels, then you can use it.
So incredibly effective.
Exactly.
It's really great.
Yeah, and this is why, again, you know, we can say, like, can you say magnesium oxide is the worst magnesium supplement? No, because you have to individualize it. What am I trying to address with it? If I'm trying to address constipation, then magnesium oxide is amazing. If I'm trying to increase magnesium status in the body, then no, magnesium oxide is not a good supplement. So that's why you have to ask, well, for whom, right? Who is this supplement for?
Would we say it's superior to citrate for the bowels?
In terms of, yes. Yeah. So
for constipation?
Yes, absolutely. Yeah. So, and it's also the least expensive one as well, too. So,
Is there any type of magnesium that's better for muscle cramping and muscle recovery than bisglycinate?
For muscle cramping, I would say bisglycinate still is kind of like at the top. Now, if you're looking at energy production, then you may want to consider something like a malate, right? But that's not so much for cramping, but just increasing ATP, right? Because malate is part of that citric acid cycle. So then you're looking at the properties of the malate, right? What can it do? Exactly. Yeah.
Excellent. Okay, good to know. How do we know? I used magnesium threonate for the first time in my career recently. And I'm interested to know how you use that product and why.
Yeah, so magnesium threonate is, again, better at certain things than magnesium bisglycinate, and that it can cross the blood-brain barrier, right? So with minerals, the reason we need them is because they're essential. Cannot make them, we need to eat them, right? We need to ingest them, or I guess if we can have them intravenously as well, too. So again, you kind of are trying to determine where do I need this particular mineral and for what purposes. So magnesium threonate, as I mentioned, is able to cross that blood-brain barrier a little bit more easier than magnesium bisglycinate, right? So if you have magnesium deficiency and you take magnesium bisglycinate, the body is kind of just going to distribute that magnesium everywhere as needed. Some will eventually get into the brain tissue as well, too. Magnesium threonate is better at crossing that blood-brain barrier, and then you can use it more for neurological type conditions related to magnesium deficiency, which can be many, I guess, because magnesium is a cofactor, right, for so many different enzymes. And again, that's why we need minerals, because without them, all these enzymatic systems that we have in our body would not work properly.
Right. I've seen some literature on tinnitus and red blood cell magnesium deficiency. And I've gone through this process twice where I've had a person come in with this condition, they've had it for 20 years, high pitch ringing in their ears, and gone for the red cell magnesium test, and it been low, and I corrected it and the tinnitus was gone.
Yeah.
And I thought, okay, wow, this is incredible. All I did was take one very simple paper that showed a correlation, not a causation, just a correlation paper, and then took a leap on something that doesn't really cost much money. And it's been effective both times. So thrilled about that. These are the type of things that we can see when we find a deficiency and treat it. And to your point about the neurologic system, the blood-brain barrier, I'm really excited about the use of this type of magnesium in particular.
Yeah, for sure. And again, this is why we need to look at what that molecule magnesium is bound to, because you want to direct it towards the tissue compartment or system that needs it most in some cases, right? You kind of want to direct it to a more specific area.
You mentioned another one. Magnesium taurinate? Is that what you said?
Magnesium taurate.
Magnesium taurate.
It's magnesium and taurine, basically. Yeah. And this targets more cardiovascular health because of the effects of taurine on the cardiovascular system, right? So if you do have, patients more with CHF or issues related more to oxygenation of the heart, even, then magnesium taurate in some cases may be more beneficial than a magnesium bisglycinate.
VitaminLab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and VitaminLab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
That's really interesting. I wonder if it's helpful for performance. The taurine can be good for performance. I'm interested in oxygen consumption, right? I'm interested in VO2 max. It's a key part of my practice. So I'm always thinking about optimizing performance, and we recently started using a lot more taurine, but I had never known that there was a product or some potential combination of magnesium
and taurine. Yeah, for sure. And then again, you also have to look at the side effects too of these mineral chelates. That's what we call them, right? In terms of what you would want or what you may not want from that ligand, from those molecules.
Can you tell me about some of the things we might expect? I know with the citrates and the oxides, we see diarrhea, we see loose stool, in people who don't need them.
Specifically with magnesium or with other types of minerals? Because, generally speaking, with these ionic forms, we do see more side effects, right? And this is where people don't like taking supplements because, they end up with the loose stools or the constipation with the iron, or sometimes even with gas and bloating. And so, for example, I've had as you said, a client tonight, as you've given them magnesium and they saw major improvements in their symptoms. On the other hand, I had clients who were taking, the poorer forms of supplements. So in this case, they were taking a magnesium carbonate. And, the client came in with a lot of gas, a lot of bloating. So, diet was very clean, digestion was well, what is happening? So anyways, we determined it was the magnesium carbonate, which sometimes, is being marketed as this natural form of magnesium, right? And people take that. So we took away the magnesium carbonate, and the bloating and the gas went away. Exactly. Yeah. So same thing with for example, iron, right? Oftentimes people supplement with iron sulfate because their medical doctor told them they have anemia. They go to the pharmacy, they pick up iron sulfate, and then they're terribly constipated. Well, the reason for that is because that iron sulfate dissociates. Some of the iron gets absorbed, but a lot of it stays in the bowels, causing that constipation. Right? And this is where, again, where an iron bisglycinate or a heme iron is a lot more appropriate because it gets into the blood as opposed to staying into the bowels and causing those side effects of constipation.
They still need to be on an empty stomach, correct? Or does it matter?
No. So, yeah, this is why with chelates, bisglycinates in particular, you can take them with food. You can even combine sometimes minerals, right? Oftentimes we hear don't take your calcium and iron together, for example, because they interfere with each other's absorption, but they do if they are in those poor salt forms and they become dissociated, because that's when that competition happens between ions, right? This is where usually calcium will outcompete any other mineral because it's kind of like bigger, kind of bullies them out of the way, right? Versus if it is really well bound, in the case of bisglycinates, they don't become dissociated. So they're not affected by the pH of the stomach, so the acidity, they're not affected by the alkalinity of the intestine. They are absorbed through these transporters because the body really likes to absorb dipeptides in particular, like two amino acids together. And the body kind of doesn't know what's in the middle, right? Because you basically have this iron bound to two glycine molecules, or calcium bound to two glycine molecules, magnesium, and so on. The body absorbs it and then dismantles this molecule later on, and then again distributes that mineral in the tissue that it needs it. So you don't really get into the side effects, the competition when you're dealing with bisglycinates as compared to magnesium oxides or magnesium carbonates, iron sulfates, calcium carbonates, and so on. Yeah.
Absolutely. Well, this is the master class that I was looking for. I love it. Thank you so much. On the side effect side of things, I totally hear you. I've been obsessed with the extracellular water versus total body water. So thinking about my hydration status and what's actually in the tissues of myself and my patients. And so I've been using a lot of minerals and trying to increase the hydration status. And I know a lot of integrative practitioners are talking about this online on YouTube recently, talking about the value of mineral water and the differences between regions. There's a big difference. We went to Whistler for the first time in our lives recently, and the difference between the water in Whistler and here is like insane. The water in Whistler is so hard, it's so good, like you could taste that there's actually minerals in it, similar to the Gulf Islands in British Columbia. In Vancouver, there's none of that, and I can tell because I do so many measurements of people's extracellular water. So I was recently have been trying to optimize my own mineral status, and so yesterday I did one of very, very common, very popular electrolyte drinks, and did not sweat, did not exercise yesterday, and very clearly didn't need it. And it was a combination of 1-to-1 with potassium and sodium, and got a headache that lasted the rest of the day. I think maybe because of too much sodium, hard to say. But the side effects are possible, and you only really want to be taking sort of like what you need or what your practitioner has determined you need based on your symptoms. Are headaches something that we see? What other side effects could we be considering with mineral supplementation?
I think nausea is a big one, especially with zinc and selenium. And this is why, again, if they are bound usually to glycine, the selenium not so much, but like zinc bisglycinate, for example, is also less nauseating than something like a zinc picolinate. Right. Because you don't get that dissociation, and then the mineral doesn't come in contact with your gut mucosa, causing that like kind of like terrible nausea feeling. I don't know if you've ever taken zinc or selenium on an empty stomach. It's the worst nausea.
I have.
In some cases, yeah. I mean, some people have, iron guts, like they can take supplements on an empty stomach. They don't feel anything.
Never heard of nausea before.
Yeah, exactly. But most people, if you do take zinc, especially in a higher dose than like 5-10 milligrams, you can feel that nausea for sure.
Definitely. If it's I have two questions around this. The first would be around the bisglycinates. Are they better with food? Like, so we know it doesn't matter if it's an empty stomach, but is there actually a benefit to absorption if you consume them with food?
I don't know that there was a study that actually looked at whether they're better, but I mean, minerals are found in food, so ideally you take these minerals with food. Now, if you take it on an empty stomach, it's not to say that the body won't absorb it.
Right, it's still going to be okay.
Still actively likes to absorb those dipeptides, right?
Right. Yeah. Okay.
So, but sorry to interrupt. In the case of zinc, selenium, definitely I would say take with food because, again, I mean, some will still dissociate. They're not like impermeable to any changes in pH in the gut. So a little bit may dissociate, and then you will have that nausea feeling.
Right. Okay, thank you for that. Yeah. We don't do a ton of zinc assessments in our practice. It's not a big part of our clinical practice here, mainly because the cost of the single test is so incredibly high, and we feel that it's quite safe to do pressing and pulsing, like taking turns with zinc usage. But I only ever really use 2 forms. Like I'm only really using zinc bisglycinate and zinc picolinate. Can you tell me a little bit about the differences in types of zinc and how we might use these forms and other forms?
Right. So with picolinate, some people may be actually sensitive to it. So that's where that ligand can actually irritate the nervous system in some cases. There are other zinc formulations as well, too. You might find zinc
sorry,
citrate.
Hold on. Did you say the nervous system? How does zinc picolinate irritate the nervous system? Can you tell me a bit more about that?
I'm not sure how. I just know that picolinic acid in some cases, for some people, is like a nerve irritant, so they don't react well to it. So this is, again, why we have to look carefully at that ligand. I'm not saying bisglycinate is the best. Zinc citrate is also okay if you don't get nausea and it's well absorbed. However, I probably wouldn't choose the zinc oxide, for example, which you oftentimes see in like more, I guess, multivitamin type formulations. And because zinc oxide, again, is not very well absorbed because of that dissociation in the gut.
Absolutely. Does it cause diarrhea?
In higher doses, it could. Generally, you don't find it in such high doses in the multivitamins. You see in like the 2-3 milligram range. So
yeah, right. I interrupted you because I was thinking about this nervous system excitation by the zinc picolinate because I use it a lot, and that's really important to me. And you were saying about the other types of zinc and how we might use them.
The zinc bisglycinate, or
how might we use zinc bisglycinate? Like, what do you see in your practice, and what do you teach about zinc bisglycinate? I know that we use bisglycinates and citrates for immune support, right? So trying to shorten the duration of a cold is kind of my main go-to. And then I think about it in terms of collagen production, muscle recovery, and skin health. But that's really it. And I get people asking and coming in all the time saying, I take zinc every single day and I've been doing it for 20 years. And often I tell them to stop because I'm worried about the zinc-copper balance.
Yeah, for sure. So I think like if absolutely, I'm in agreement with you. If you do take it like long-term, or if you take it in higher amounts. So usually for women, what's considered higher is like 30 milligrams. For men, like 50 to 60 milligrams. If you take it more than like, a couple of weeks, maybe consider adding a couple of milligrams of copper, right? Usually we look at 15-to-1 ratio, so 15 milligrams of zinc to 1 milligram of copper. Fertility is a huge one, especially with males, and boosting testosterone, like in terms of, again, testosterone production, as well as I said, fertility.
Gosh, yeah, absolutely. Yeah, we've used it for that as well before.
And then if you mentioned muscle mass, right? So for men, obviously, testosterone loss will affect muscle loss. So if you're looking at preserving testosterone production in the body, one of the ways it is, right, we're using zinc. And also I think it prevents the aromatase as well from converting like the testosterone into estrogen, right?
Zinc is helpful for preventing the conversion.
Right, exactly. In men who tend to be a little bit more estrogenic as a result of insulin issues.
Absolutely. Okay, thank you for that. Gosh, now we have like this whole, I can see a tree of life happening here with zinc. This is, I'm mind mapping the whole thing.
But as you mentioned too, right, careful with copper, right? Especially if you're taking like longer doses or a dose longer term, you do want to supplement with copper because the body has this ratio that it likes to maintain when it comes to minerals, right? So whenever one is either too high or too low, you're affecting the ratio of the other one, meaning that the processes utilizing those other minerals tend to slow down. So like, for example, we have calcium to magnesium to phosphorus ratios in the body, zinc to copper. So anytime you push one too high or too low, if you're deficient, then you're upsetting those other processes because the body sees a deficiency in it, right? And it's relative deficiency, but it's still a deficiency.
Right. You can still have the symptoms of the deficiency, even though it's just relative.
Yeah.
Can you tell us a little bit about how we might be assessing these minerals? I know in our practice we use blood tests for serum, we do blood tests for red cell, we do urine, we do hair, we do all these different tests. Do you have a preference? Like, how do you determine when to do which test, and what do you think is the best for some specific conditions or circumstances that you might see a lot?
Good question. So I don't think there is a best. I think each mineral, we have like a better test for it, right? So magnesium, red blood cell. For a lot of minerals, I would say red blood cell is better in terms of like actually knowing the body status, right? Because if you're measuring just blood, we know that the body likes to maintain most of the ions in a very tight range, right? So if you do have calcium, for example, being off in the blood, it has nothing to do with your overall calcium status. There's other processes that are being affected, right? Same thing with sodium, potassium, and so on. So red blood cell, I say it would be one of the better ones. But if we look at calcium, there's no better test other than, I guess, the DEXA, the bone scan, right, in order to determine the storage, right? With iron, I would say a ferritin panel, right, and an iron panel would be effective because red blood cell would probably not tell us that much. So the best answer would be like each mineral has the best test depending on what you're looking at. Generally, you're looking at storage, right? Like how much does the body have of this particular mineral? Yeah.
It's interesting you bring up the calcium example, right? Because we think about when you see an electrolyte calcium assessment, just a serum calcium assessment, it doesn't tell the whole story. And I think that's the same with other minerals. But for sodium and potassium, often we think, oh, that's the whole story, whatever. So in our practice, we've been looking at total body water and then making sure that it's 50% of a person is total body water, and then considering the extracellular water ratio to total body water. But then we don't know which mineral it is. And it's like the serum assessment for sodium, potassium, calcium, magnesium, and phosphorus tells us really about, for us, we're pretty satisfied with the potassium level because it's not so freely cleared by the kidneys, but the sodium level is different. It's so freely cleared. It's like, what is the actual tissue level here? So I was recently thinking about my own salt consumption and like what I actually need to be taking, because my wife is a nutritionist, and so we try to like dial in our nutrition. It's fine tuned. Then you look at the amount of sodium that I consume. I thought it was like, oh, salt is bad for me because there's cardiovascular disease in my family. My wife loves salt, right? Like it keeps her blood pressure normal because it would go too low without. And I was looking at my amounts, and it turns out I'm way under consuming sodium. Way under consuming. And I'm assuming, but my blood tests are perfect.
Right. But I'm assuming you're not consuming sodium chloride. We're talking like Himalayan salt or sea salt. Okay. Good.
I am a naturopath.
Good. After all, yeah. I think with sodium, it's a little bit more difficult for me to talk about because generally, as you said, we don't really have this in a supplemental form. It's just through consumption in foods and whatever you may be adding. So personally, I haven't played around with that type of testing. Potassium you can definitely supplement with, but you again have to be careful, as you mentioned, because you don't clear it, so you can end up with different types of side effects.
Incredibly careful. In fact, in Canada, we only have the 99 milligram capsules,
yes.
So we have access to.
Yes.
But you know that well because you're our resident expert.
I don't know that. Definitely know a little bit about minerals, from the supplementation perspective. Yeah.
Definitely.
So
you've been through so much in your career, and you've gotten to this place where you're teaching about nutrition and teaching about supplementation, and have become an expert in this field. And I'm wondering if you're speaking to a new grad, if you're speaking to a fourth year CCNM or other naturopathic college student, what kind of advice would you give a junior naturopath entering into this profession?
Oh boy. At least from my perspective, I would say self-care becomes very important. Right? And I think it's easier said than done because when you graduate, I think you want to go straight into practice and work and do all these things. But it's important not to as they say, burn the candle on both ends. So I think it's very important to replenish if you're able to. Because with practice, at least the way I see it, it's kind of like, especially in terms of building it, I think it's a long-term game. It's not kind of like who's the fastest out of the gate. And I would say also, I mean, it really depends, because I didn't go just into practice. I was, in a way, lucky enough to be exposed to the supplement world through my work in like the retail, and then eventually working as a therapeutic advisor and for a supplement company, and then going into teaching. So I do enjoy having these different branches of, I guess, work. Right? So it kind of really depends on how you envision your practice. If you just see yourself as just a clinician, or you see yourself as more than just a clinician, in terms of work.
Absolutely. Oh, I'm right there with you. Whenever we have people join our practice, we typically suggest that they start teaching right away. Because the teaching, it keeps you connected to the medicine and connected to what's new. And, it's fine to sort of like read the papers that come across your desk every month, whatever journals you subscribe to, but actually having to teach the material and think about it in new ways as it changes over time and interact with the research, compare the new research to what your knowledge is and how it fits with the course outline. I think it's so valuable. Have you found that? Like, you're teaching to nutritionists, am I correct?
Nutritionists, correct. Yeah.
Yes, absolutely. Me as well. And what have you found when you're teaching to nutritionists about, I don't know what courses you teach, but about integrative medicine, about nutrition in general?
I teach hormonal health and mental health.
Oh, incredible. I love it. Nutritional approaches to these?
Nutritional approaches, of course, right.
Treatment-based.
Well, as you know, like at least in Ontario, where I'm, like, you can't really use treatments. You can say recommendations.
Sure. Yeah. Sure.
But,
Okay.
But yes, recommendations, approaches for mental health conditions and hormonal conditions as well.
Oh, I love it. I only get to teach about the labs. I don't get to, to teach about
it.
how to support. How to support. Oh my gosh.
Yeah. The way I teach it, at least the way I see it, is, again, not. And I remember as a new grad too, I was, in a way, a little bit intimidated. I'm like, oh my goodness, how do I treat somebody with like depression? They've had depression all their life, or they've had anxiety. Like, if you sometimes may not have experienced those conditions, it can be a little bit daunting, right? And my approach is always like, look at the root causes, and again, look at those foundational things, like what is sleep like, right? What is their circadian rhythm like? What are they eating? Take that, take a good intake, right? Because you want to know all of these different aspects of them, because whether they experience depression, or whether they experience anxiety, an autoimmune condition, we all have the same not basic, but I should say that we all have the same mechanisms, right? And these mechanisms will affect differently, or will present itself differently in different people, right? So, for example, stress in somebody may present itself with anxiety, versus in somebody it may present itself with like a low immune function.
Oh, good example. Yeah. It's so interesting to talk about this, because I don't get an opportunity to teach about this, but thinking about the physiological aspects of these conditions and how we can support them through nutrition, thinking about the physiology. And it sounds sort of like that's what you're doing.
Exactly, yeah.
What do you see the trends in the industry? I mean, right now in the supplement world and the nutrient world, what do you see as key trends, things that patients are, getting excited about, that maybe we want to be thinking about as practitioners? Because, it's, as people sit in your office and they say, hey, I learned this new thing. It's the best thing. Like you said earlier, it's the best thing in all of supplementation. And then they end up knowing more than us. So how can we help practitioners stay on top of what's new? What are you seeing out there in your world that maybe we should all know about?
Oh boy, that's a good question. I think you're right in the sense of that sometimes it seems our patients know more than we do. But I think, unfortunately, a lot of people are also vulnerable to ads, to right, the way things are presented in the industry. So it's still important to have confidence in yourself as a clinician, because at the end of the day, if you know what magnesium is good for example, you don't need to stress so much about all the different forms. I think you will come to use probably some of the better ones out there, because those ones are the ones on the market. I'm using magnesium as an example. And again, I think oftentimes, and I don't know about you, but I used to get clients who were like, oh, I'm taking this particular product expecting to kind of fix everything. And it's important to, again, go back to the basics, because like taking protein is still not going to, address your sleep issues, or I should say sleep debt. Or taking protein is not going to necessarily affect your stress levels if you're not managing your stress, so minimizing your exposure to stress. So one particular supplement is not going to fix it all, right? And this is where we come in, and as practitioners, and I think explaining to our patients that like just that one supplement is not going to fix their whole problem, especially if they've had chronic conditions or concerns for years and years. And just because it is the best, it may not necessarily, again, treat all of those things. And most people are looking for that easy fix.
I hear you. It might be the best promoted, for example, the best marketed.
Exactly.
Totally, you're right. That is a pretty common trend that's going around, where companies are sort of like putting everything into a supplement. It's a very comprehensive supplement, and then marketing it as the be all end all for all conditions. And we know that that's not the case. And so what we're trying to do in our practice is really individualize our approach, and that's kind of what you're speaking to.
Right. So like taking adrenal formulations as an example, right? Like if you look on most of them, you have like 20 ingredients, right? There's like 10 different herbs, I don't know how many minerals and so on. And that's where you have to go back to the individualization. Like maybe you cannot take 2 of these herbs because of your autoimmune condition or because of your sensitivities and so on. And this is where we come in terms of individualizing the ingredients for that one particular client. Because yes, ginseng may be the best adaptogen out there, but not for certain people, right? Or same thing for other types of herbs and so on. Yeah.
That's an excellent example. How many times have we seen people taking adrenal formulas that are meant for burnout and not for anxiety, or not for high cortisol versus low cortisol?
Exactly.
It's so incredibly common in our practice. You go to a store and you see a formula on the shelf and it says adrenal support. And because you're stressed and feel like you're down, you think maybe that's the right thing for you, but it turns out it's either like way too stimulating or actually suppressing of cortisol when you need to be boosted.
Or not taking it at the right time of the day, and right? Because sometimes you have to take certain adaptogens in the morning, some in the evening, right? So yeah, absolutely. And again, that's where that testing comes in, and we come in too, in terms of then where is your cortisol at in the morning versus where is your cortisol in the evening or during the day, as opposed to just taking this one formula that kind of like fits all. Yeah, absolutely.
I feel like it really informs the dosing strategy too. When you're working with someone like an integrative physician or naturopathic physician, you get so much more, for one, objective tracking, right? Evidence-based dosing strategies. When you're just purchasing on your own, you're not going to get that. And that was a big struggle for me initially. Turns out that I took creatine all through my young adulthood, actually, as a teenager. Took sort of like the evidence-based approach of creatine. And I would go through these periods of following the loading dose and then doing the 5 grams a day and then like feeling really good and then breaking out in a full body rash and realizing like, this is not for me. What am I doing?
Right.
When I could have simply been working with someone who had some experience, who knew that there would be some value for me, but maybe the dosing strategy is not appropriate for the tissue level that I have currently. That would have been so valuable for me as a young athlete to know that.
Yeah, absolutely. I think and this is where, again, that intake comes in, right? Knowing your client, right? Because what's good for, again, maybe somebody who's 50 kilograms is not going to be good for somebody who's 100 kilograms. And we're looking at muscle mass, right? As well too, and adipose tissue in these individuals when we are giving particular nutrients, right? Versus when you're purchasing something off the shelf, then you're going to get the recommended dosage, which is for most of the population, and also what's considered or deemed, safe in Canada. you kind of like, hopefully you hit the right dose, but in some cases you may not. Right?
Absolutely. Gosh, listen, Corina, I got so much out of our chat today. Like, thank you so much for your time. We appreciate
Thank you for having me.
all of your comments and all of the lessons that we received about mineral dosing strategies and types and side effect management, everything. My gosh. Where can our listeners find out more about you and connect with you?
Well, currently I'm on hiatus because I have an 8-month-old daughter, so I'm not practicing. Thank you. But hoping to be back in some kind of form in terms of practicing maybe in the next year or so, but we'll see.
We'll see. Okay. Good to know. Well, thank you so much for your time. We appreciate you. Thanks for joining Personalized, our new show. We're so grateful to have you in our first week.
Thank you again for having me. Lovely speaking to you, David.
Same to you. See you.
Bye.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Dizer and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.